everyone, in this video, I'm going to talk about demonstrations of 4 tools of communications for staff member. There are several communications tools for nurse that can be used to improve interaction with patient, communicate more effectively with physician, and ensure smooth handover to colleague. The use of these communications tools in nursing can help to improve patient's outcome, patient satisfaction, and reduce the potentials for error. They will be SBAR, A for assessment, BAF protocols, and patient teachback. First is the SBAR. The SBAR is one of the most common communication tools in nursing for structuring conversation. SBAR is an acronym. S stands for situation, B stands for background, A stands for assessment, and R stands for recommendation. It is a tool that is used for structured communication to ensure that information is transferred accurately between two people, such as during a shift transfer. So for A for assessment, S is for situation, B is for background, A is for assessment, and R is for recommendation. The background provides a brief description of important background information. For example, John was admitted yesterday with chest pain and has heart failure. Assessment. Provide your assessment of the patient. For example, I have assessed the patient and I am concerned because he looked very unwell and I'm not sure what the problem is, but his condition is deteriorating. Recommendation is provide your recommendation to the patient. For example, I need you to come and see the patient within 15 minutes. The initiative of the communication should also get the receiver to repeat key information to make sure it has been understood. For the next one is BAF protocols. The BAF protocol is like SBAR, serve as promotes for 4 questions. BATHE is an acronym standing for background. What is going in your life? A. Affect. How is that affecting you? T. Trouble. What is causing you trouble about the situation? H. Handling. How are you going to handling it? And E. Empathy. For example, that must be full for you and very frustrating. So for the next communication tool is the patient teachback. Patient teachback is an effective communication strategy for ensuring the patient has understood the information provided by a nurse. In short, the nurse explains a set of instructions or provide health information to the patient and then ask the patient to explain that information back to the nurse in their own words. This approach helps the patient take the information on board and let the nurse know if the patient has understood what was being said to them. Nurse should explain to the patient that this is not a test, rather it is one of the communication tools in nursing that help nurse determine whether they have explained things clearly to you. That's all for me. Thank you.